Second. All right. All right, so we're gonna go ahead and get started. I would like to introduce to you a very, very good friend of mine, a community partner. We've been aligned doing community work throughout San Francisco. I know for me and her, at least the last 10 years. For her, it's probably been way longer than that. But I'm just so happy that I'm able to host Marna Armstead today. With over 25 years of experience in entrepreneurship and business management, Marna serves as co-founder and current board chair of SisterWeb, which is a San Francisco nonprofit. She has driven rapid programmatic and fiscal growth, growing the initial budget of $233,000 to $2 million. Despite launching during COVID, Sister Web has continued to hire, grow, and thrive under her leadership, becoming nationally recognized and supporting other doula organizations in developing their programs. She also operates Marna Mama Doula, providing private doula services nationwide to women and families of color. So I just want to welcome Marna Armstead, and I'm gonna turn the floor over to you. And I just ask if everybody can please mute your phones, mute your computers, and Marna, you can go ahead and take it away.
Thank you, Brittany. Can you hear me? Excuse me.
Hear you very well.
Awesome. Great. So good afternoon, everyone. It is great to be here with you all. I am a good friend of Brittany's, but like you said, I'm also a community partner. So I've known Brittany for goodness, we grew up together. So it's great to continue friendships and be in community with you all. So good afternoon again. I want to thank you for coming and attending my TED Talk, my little conversation with you all about medical self-advocacy. And I want to start by telling you a little bit about me. I know Brittany just offered some information, but I'm a mom and I'm a brand new grandma and I'm a community-based doula and I'm a health education advocate. And so that's where I'm coming into this work in addition to everything else that I do. And for 10 years, I've been working in health advocacy, a minimum of 10 years officially. I co-founded the Doula program in San Francisco called SisterWeb, as Brittany stated before, where we support Black families birthing in San Francisco. And I've also served on healthcare policy committees, including the Medi-Cal Doula Implementation Work Group for the state of California. And I've also co-authored research on how healthcare providers respond to patient advocacy. So that's where I'm coming in today. And I'm going to start by sharing my screen. So bear with me because me and multitasking sometimes don't work out that great. So laugh with me and we're going to keep it going. Can we see my screen? Yes? Thumbs up, someone? Okay, cool. All right. So today we're going to be talking about your voice and your health and mastering medical advocacy, mastering medical self-advocacy. And before I begin, I want to just share with you some opening inspiration and something that's going to guide our discussion today. So Maya Angelou, the poet and civil rights advocate, also former San Francisco advocate, also the first Black woman to operate a San Francisco cable car, said that when you learn, teach, when you get, give. So as I'm learning, I'm teaching, and as I'm getting, I'm giving, and I am hoping that you all will do the same. And that captures what we're here to do today. And I want you to know that every single person here today already has what it takes to be their own healthcare advocate or to advocate for a loved one. And so today we're just going to strengthen those skills. So I'm going to ask for some interaction and participation here today. And I'm hoping that you guys don't leave me hanging. All right. So I'm going to start today about how my journey began. And so this is a picture of me and my dad. And my medical advocacy journey didn't start in like a classroom or a boardroom or on one of the committees that I served. It started with my father when he had a massive heart attack. And so briefly about my dad, he was just not a person who was sick. He was active, he was healthy from what we knew. Yes, he was older and he had some of what I like to consider when you get a certain age, some of these things become conditions in your life, such as high blood pressure, etc. But it seemed to be well managed. He seemed to be great. He barely even got a cold. And one day he suffered a massive heart attack. And suddenly he was unable to speak for himself or advocate for himself. And everything was up to us. So I found and my family found ourselves navigating this complex healthcare system, trying to understand the medical terminology and coordinating between all the specialists and understanding the condition, his condition, and how it affected other conditions. And we wanted to also make sure that my father's voice was heard, and especially since he couldn't speak, and that what he would have intended was honored. And this was also important. He had a trust and he had advanced care directives. I know Brittany and Wise Health works with that. We'll talk about that a little bit later, but those were in place. But we did have to start advocating for him. So we learned to ask questions. We learned when to push back respectfully. We learned how to build relationships with the nurses and the doctors and the specialists, and learned about being prepared and being persistent and partnering with our healthcare team. So that experience taught me that advocacy wasn't like, it's not something you just know. Most people don't just know. You're not born with it, but it's something you can develop like a muscle. And unfortunately, I was developing it during a crisis. So I want to give you these tools before you need them most. So why does medical advocacy matter? So healthcare disparities are real. So I put a little bit of data up there. When we're not um, tending to our needs and advocating for ourselves, we have these kinds of outcomes. So communication breakdowns happen, and bias and discrimination does exist in medical settings. So, but here's what I've learned is that when people know how to advocate for themselves, or they have support through loved ones, they have support through doulas, they have support through other systems, their health outcomes improve dramatically. And in my work with families through the birth work and other healthcare experiences, I've seen over and over again that the informed, supported patients get the better care. That's not necessarily fair, but it's the truth. And it's not because they're demanding or difficulty, but they're partners in their own healthcare and they know how to do it. So today we're going to learn how to be more informed and effective and partner in our own healthcare, and we're going to help others do the same. So the first thing is first is you have legal rights as a patient, and knowing them is the first step in advocacy. So you have the right to information. You have the right to participate. You have the right to privacy. You have the right to voice concerns. You have the right to refuse treatment. You have the right to respect and dignity. You have the right to equal care access. And these are not privileges. These are rights you already have, point blank, period. And we're just going to learn how to use them effectively. So, medical advocacy and self-advocacy is just being an active participant in your own healthcare and for your loved ones. And so I'm going to break down into four key components what you see here. So the first is communicating your needs clearly. This means knowing how to express yourself, your symptoms, your concerns, and your preferences. It's saying things like, I'm experiencing pain that feels like ... pins and needles, radiating pain, whatever. Not just saying I'm in pain, or asking, can you explain that in simpler terms when you don't understand? Second is asking informed questions, coming in prepared as possible, knowing what questions matter. What are the side effects of this medication or procedure, for example? How long will this take to work? And what happens if we don't do this treatment? Third is making empowered decisions. This is where the brain method comes in, and we'll learn that shortly, but it's really powerful. So you have the right to understand your options and choose what feels right for your body and your life. And fourth, you build collaborative relationships. Healthcare works best when it's a partnership. So bring your lived experience and the knowledge of your body, and your provider brings their medical expertise, and sharing the information and communicating together and partnering with each other so you can make the best decisions. So here's what I want you. Brittany, you have a question, Brittany?
I just didn't know. I missed the part where you said that it was interactive, and I wasn't sure if we could ask questions in the middle of the presentation or not. I'm sorry.
Oh, do you have a question?
Yeah, I just wanted to
Uh-oh.
know if you could elaborate a little on the building partnerships and if they have, I don't know if you're going to elaborate more, but
Yes.
if it has to involve in the hospital or can it be like outside the hospital too? That was all.
I'm going to talk more about that during the presentation, but it's going to be both internal and external, like in the
Okay.
hospital, outside in your community, and we're going to do a little activity about kind of partnership building.
Okay, got it. Thank you.
Okay. So, again, you're the expert on your body. Your loved one is the expert on their body. Trust them, believe them. And the medical advocacy is honoring that you have expertise and the medical team has expertise, and you guys are just going to work together to make the best decision for what you want for yourself. Ooh, ooh, ooh. All right. So, I'm going to share what changed everything for me. When my father had his heart attack, I thought I was prepared. I had, started doing some community education, community health education, and I knew a little bit about hospital systems, and I was starting to learn how to navigate kind of the bureaucracy within the systems. But when I was sitting in that hospital room with my dad, and he was not able to talk, and it just a lot of things were going on, and he was struggling, like everything was different, and that's from somebody with a little bit of experience at the time. So I found myself navigating the same exact challenges that I'm talking about here. The hospital buildings and the systems felt like a maze of craziness. There were different specialists, there were different appointments, there were different departments, there were medical providers who didn't talk to each other, there were specialists. And I spent a lot of time trying to just figure out who was what, who was in charge of his care versus a specialist versus a doctor versus anyone else who popped in and wanted to get involved, right? So I learned tools like taking time to think about my father and my family's needs beforehand, carrying a notebook and writing down things, asking the medical providers to slow down and to repeat things and to push back respectfully, and asking them to explain and re-explain how what they were saying, what it meant for my father specifically. And the hardest part was really knowing when to push back. When the medical team suggested treatment plans that didn't align with what we thought were my father's needs and our family's needs, we had the courage to say, wait, let's talk about this. I had time, and I had to at times invoke the rest of my family network, community network, and even some of my church community. So this is what the quote by Nicholas Sparks at the bottom is talking about. This is exactly what I learned. Care is about love and action, showing up, asking questions, and pushing back when you're told. That's just how we do things when it doesn't serve you or it doesn't serve your loved one. So every single person in this room on this call has that same power. You need preparation and persistence and the belief that your voice matters. Ooh, now I'm going to advance. All right, so we'll get to our first framework, our first decision-making tool, and it's called the BRAIN method. So this is at the heart of good health advocacy. Good advocacy in general, you could actually translate this to a lot of different things not just healthcare. But in birth work, we use something called the BRAIN method for medical decision making. And it was crafted by the mindfulness-based childbirth and parenting educators. But this framework can work for many in any healthcare situation, from choosing how to treat a condition like diabetes to deciding about surgery. So you go through the acronym B, benefits. What are the potential positive outcomes of this treatment or procedure? So you think about that, you ask that to your medical provider. You go and get their answers. Then you ask, what are the risks? What can go wrong? What are the side effects or complications of a treatment or procedure or whatever they're asking you or talking to you about? Then you think of alternatives. What other options do I have, including doing something different or getting a second opinion? Then you go through your intuition. What does my gut tell me? How does this align with my values and goals? And I talk about the intuition part because that's less like very direct. It might be just a feeling you've gone with this, with the doctor's choices or with the method, you've done the procedure a million times, and suddenly something's saying, no, don't do it. Or the opposite, you've been so against a certain thing or whatever, and it pops up and you're like, this is it. This is what I think is the most successful decision for me to make, or alternative decision for me to make, because my intuition is telling me that. Maybe it's going with exactly what the doctor said. Um, and then in the brain method means nothing. Is this urgent? Can I take time to think? What if I don't do anything right now or at all? So what if you do nothing and you're not questioning your doctor's expertise? You're trying to make your most best, greatest decision, right? So you want to have all these things and you want to have an open conversation. And here is the framework that you can use. So this next thing, we're going to advance to the little activity. So this is the first one. And I would love for you all to come off mute so that we could do this activity. And we're just going to take about 5 minutes or so to do it. So um, here is the scenario. You're on a visit to your doctor. You've shown elevated blood pressure for the second time, and your doctor wants to start you on blood pressure medicine. So if you were thinking about using the brain method tool, what types of things would you ask? And take a minute to think about it, but I would love for you guys to just pop off mute and just go on and be a little vulnerable and help me by participating. Don't let it fall flat.
Is this permanent?
Is this permanent? Okay, good question. What
What
else?
are what are the risks involved? The
Okay,
side effects.
and taking the medication, right? Because the risk might decide whether or not you're choosing for an alternative.
And
Any,
how does it affect any other medication I'm on? Because sometimes I'm taking medications that shouldn't be taken close together,
Mhm.
but they don't tell you that until you find out by accident sometimes.
Yeah, yeah. And just to your thing, you can also always ask your pharmacist. So
Yeah.
whenever you get a new prescription, if you decide that you're going, like in this scenario, you're deciding to go with the blood pressure medication, right? So you go to you ask the doctor, they tell you some stuff, and you go get your new medication, and they ask you if you want a consult. They should be asking that. But if they don't, just tell them that you want a consultation, and they'll send you with the actual pharmacist, and you could ask them about any interactions with other medications you have. So that's just a little side piece for that. And I see Brittany come off mute.
Yeah, I see in the chat that Miranda had what about lifestyle changes? And it just makes me think like, what else can I do to not take medications? Like what are my, options to not take meds?
Yes, yes. And even like, okay, so we talk about alternatives. So some of the alternatives, for example, you might say, so they're saying this is the second time you've come in with high elevated blood pressure. So, you have a history of having come in with it before. They want to put you on blood pressure medication. So you could say, do I have an option of doing a couple more blood pressure checks in the coming weeks before I go on this medication? Do I have an option of maybe talking to a registered dietitian about my lifestyle changes? Do I have an option of stepping up into a different or elevated fitness routine? Like, do you think that will help? And those are conversations you can have, and you can always tell your doctor, like, let's say you don't want to do it now or right away or whatever. You want to see if you could work it out. So you could ask them, like, I'd like to, can we set up a follow-up appointment with a couple of blood pressure checks in between, or you have a blood pressure monitor and you're going to give them your readings. And let's decide if my blood pressure is still elevated, maybe I'll accept the prescription at this point, but all of this to say, there's no real wrong answer. It's just about how does it feel to you, right? Are there any other, I can't really see the chat. So Brittany, if you could help me with the chat. Is there anything else in the chat?
Oh, I'm sorry. I've been running my mouth and I've been on mute. Okay, so Miranda has some good questions. And Tone, what's causing my high blood pressure? Is
Mhm.
this long term or short term? What are the side effects? I've been under some stress. Could this be a sign of menopause? Or are there any other indications from like family history? So, and I like that too because sometimes blood pressure isn't always like, diet.
Mm-hmm.
It can be like genetics,
Mm-hmm.
stress. I didn't even think about menopause. Lord help me.
Mm-hmm. So
Oh,
there are all types of reasons why you might in this scenario have an elevated blood pressure. So instead of just listening to the doctor who's just straight to let's put you on medication, it is good to be able to bring up things like this. And sometimes you don't always have the mindset to bring up everything right in the moment, depending on sometimes they kind of spring something on you and you're not prepared. So it's always good that where you could follow up with your doctor or set another appointment to discuss it. Or one of the things you say, doing nothing or wait, right? Like, you're just loading me up with some information there, doctor. Can I have a minute to just think through my questions and my thoughts, like, what's going on, and even going back over what's happened in the last month or two, in between those times, like you were saying, past history. Have you been under stress? Have you not been sleeping? Has there been something else that might impact that? So
Mhm.
these are all options to go over instead of just going with what the doctor says. Not that they're wrong, but that you have an option to think through what your treatment looks like. Okay. So if we're good, I'm going to move on to the rest of it. Cool. Thank you so much for your participation. Oops, let me get there. All right. So effective communication strategies. So excuse me, your good advocacy starts with good communication. So here are some practical tools I've learned from years of working with families in medical settings. So before your appointments, write down your questions or concerns. If you have a scheduled appointment, write it down, make a voice note, whatever method you use for note taking and remembering things, do that. Bring a list of your current medications if you have any. Uh, think about the goals for the visit. For example, I would like to find out more about a side effect I'm experiencing from a medication. Or I would like for you to check and see, should I be concerned about this mole, right? That's what you can do before your appointment, is get that together. During your appointment, you can start with your most important concern. So asking, can you help me understand XYZ dot 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 instead of why didn't you tell me about that? So that's kind of the language you can use, and repeating back what you heard. So they're telling me that the doctor says something, so you're saying, for example, take the meds on an empty stomach and wait before eating. Okay, doctor, so I should not eat and then take my medication. That's how I'm understanding it. Do you understand? Do I have that? And they'll say yes, or they say no, you should, whatever else that they're going to add to that. So it's just kind of a dialogue for you to go back and forth and make sure you're understanding um, what it is that they're telling you, any information that they're giving you. And most of the time, you could ask for written information that they take home. You could ask for the aftercare visit. I know a lot of people, we have these electronic health records where you could access it on your computer, on your phone, but you can also take the printed copy with you. Because you might want to take it and share it with somebody. Like, like they had this test. I remember you said you had this test about a year ago, tell me about it, whatever. So you have paperwork to talk about that. And you can have it with you on the way home instead of just looking at your medical electronic record. And you can also use the magic phrases of, can you help me understand why this is the best option for me? And what would you recommend if this was your family member? Or I'd like to think about this. When do you need an answer? Because sometimes you might need to schedule a procedure. So it's not like, you could just make an answer and we could just do whatever, whenever. It's like, oh, okay, if you make this decision, it's going to take 2 months for us to put an appointment in for you. Or it might be urgent. We don't suggest you wait. We think you should do this right away, which then goes back to, can you help me understand? Instead of saying, why didn't you tell me about this earlier? You know what I mean? So that's an example of how this can work. And so remember that most healthcare providers, they want to help you too. So being clear and respectful is always, it makes their job easier. It's usually a win-win. Okay. And they're people too. We have to remember that they're people too. They're subject to being a full human, just like we are. And with being a full human, you might have to navigate healthcare bias and discrimination because it does exist. So I'm not acting like this doesn't exist and my solutions end everything and you'll never experience problematic treatment in a healthcare setting. And so whether it's based on your race, your gender, your sexual orientation, your economic status, the way you're dressed that day, it doesn't matter. All of those things could impact your treatment, even though they shouldn't. So I know most of us probably know how to recognize bias, right? But I'm going to go over some particular cues because sometimes we might miss it. And sometimes we're thinking it's business as usual. It could be covered up as the hospital policy. So you want to make sure of that. If your concerns are being dismissed or minimized, right? If you're not given the same time or attention as other patients through your observation, that if there are assumptions made about your lifestyle, your intelligence, or your compliance, your ability to and willingness to follow directions, that's also a cue. So if they're telling you you need to stop smoking and you're not a smoker, or you need to exercise more, and they don't even know if you have a fitness routine or not, right? Or you feel rushed or judged in any way. Those are um, opportunities for bias and discrimination in a medical setting. So here are ways for you to respond. You can stay calm. I know sometimes it's hard, like stay calm if you can, but be persistent. So you could say, I'd like to document in my chart that you're declining to order a test, for example. They could say, oh, we don't want to run this test for you. It's a waste of time. It doesn't really da da da. Okay. Well, I'd like for you to document that in my chart that I asked for a test and you're saying you don't want to give me the test. Or you can bring in an advocate with you, another person, a friend, a family member. Some people have doulas. Some people have CHWs, community health workers that work with them, or social workers. And you could also bring in certain instances, especially in emergency rooms and operating rooms, they have chaplains. So a chaplain can also be an official witness. And then you could ask for specifics. So can you explain the medical reason you're recommending against a treatment? Sometimes like, oh, I'd like to look at this. And they're like, no, we'd rather do this. Okay, can you tell me why medically? And then if it gets bad enough, you can always request a different provider. And even if it's not bad in that type of way in interaction, you could always ask for a second opinion. So, the documentation is key. So going back, whether it's in your phone or you're writing it down or you're making a voice note, dates, times, who you spoke with, and what was said, because this is not a paranoia thing. This is preparation, especially if you have to escalate your concerns. So if you have to escalate your concerns, filing grievances. So sometimes, despite your best efforts, you have to escalate. So here's a quick roadmap. The level 1 can be speaking with their provider directly or their supervisor. Level 2 could be contact your patient advocate or your ombudsman at the facility. And the ombudsman is like an official appointed to investigate these types of complaints. Your level 3 is filing a formal grievance with the healthcare organization or the provider. Level 4 is contacting your insurance company if your coverage is included in that. Like if they're denying a procedure, you might want to contact your insurance company to make sure, first of all, that that procedure can be covered. And if it can be covered, why are they still denying you, for an example? And then level 5 is filing complaints with the state licensing board and any regulatory agency, the medical board, things like that. And that's a pretty high escalation. So the key language that you want to use would be like, I'd like to file a formal grievance. I'm requesting this conversation be documented. I believe this violates my patient bill of rights, or I need to speak to someone who has the authority to resolve this matter. So escalating the situation is you getting the care you need and preventing the same issue from happening to another person. And filing these grievances and stepping up, it's not always the easiest. but sometimes your complaint might be the straw that breaks the camel's back for that provider. You may not know that provider might be a bad actor and they've been doing it for a while, and your complaint is the one where they're like, we got it. We can now do some corrective actions. We can remove this person. We could do whatever, right? But filing that formal grievance is important in following through. So I know that this can be difficult, like I said before. And so you don't have to do this alone. So Brittany, this is going kind of to your support network piece that we were talking about. So each person sitting here has their own network, right? And you're going to have to discover who you can build your support network with, right? And I have here's some little circle of support that you can go, like it's just showing you what you can do. But your advocacy team might be a family member or a friend who can attend an appointment with you, or someone that you know who's had a similar condition to yours. If say you're being diagnosed with something, and again, it's like, oh, I know so and so had this a few years ago, or they're dealing with the same condition. Maybe I want to talk to them. Or you might have healthcare staff that you can trust. It might be your doctor or your nurse or a case manager or a patient advocate. Or it could be, in the event, it could be that front desk person that's always nice to you, that's always, doing something special for you that you could talk to and get things done. And you could also try again the chaplains in the appropriate when the chaplains are available. You also have community health workers, you have doulas, you have patient navigators, you have social workers, you have case managers, you have peer support groups. Again, people with similar health conditions, professional advocates when you're facing kind of the more complex situations like caseworkers, attorneys, hospital grievance systems, insurance departments. So how can you build these relationships? So identifying uh-oh, did someone say something? Okay, identifying your supportive healthcare staff and asking to work with them consistently. So going back to that front desk person, asking for the same provider for each appointment. So you might have to be flexible. I think somebody's off mute. You might have to be flexible with your schedule. Oh, the provider you like is only available on Tuesday afternoons. Well, you might have to arrange to do that if you want to see that particular provider, if that's an option. But that could be an option. You might want to connect with community organizations like Wise Health, right? Who provides activities, palliative care classes, advanced care directive classes, social settings, cooking classes, lifestyle events, something to just, build that external network to make you just continue to feel normal, depending on what you're dealing with. You can join support groups online, in person, those are, structured support groups. And then of course, you have trusted friends and family. Your silence is not golden here. So I know when we're talking about our own health and the health of our loved ones, it's private, it's personal. You may not always want to talk about it. But again, you talking about it can help you identify the people that you trust, that you can go further with. So I'm not saying just run your mouth to everybody, but those people that you trust, you might find out there might be someone who really can't do anything for you, but listen and pray. But they're definitely going to listen and pray. That's someone to talk to. You might have another person, you might have a person in your network who does have some medical experience. That might be a trusted person. So each of us have our own different types of networks, and you just have to think about who those people are who can support you. So I know that it's not always possible to advocate in a group setting or with lots of support. Sometimes it is a solo mission, but when it doesn't have to be a solo mission, we should try to make it more of a community effort, because I think it works better for the person. So we have one more activity. And I'm going to take some time with this because there's 1, 2, 3, 4 sections to this. And we're going to do this as a personal scenario. So let's just say you've been experiencing chronic fatigue and joint pain for months. Your primary care doctor suggested it might be stress and recommended that you rest. You feel dismissed and want to advocate for further testing and specialist referrals. So, when you feel dismissed by your healthcare provider, what can you say? Come on off of mute, y'all.
You can let the provider know that you respect their opinion. However, you would really like to push for more tests,
Mm-hmm.
and you would like to see a specialist regarding the pain based on the location and the type of pain that it is, whether it's like sharp or stabbing, because then that would probably be a different specialist.
Yes. And because you've been listening, you've been preparing to say you feeling the sharp or stabbing pain or throbbing pain or radiating pain or shooting pain or whatever it is. Anyone else? All right. To prepare for your next appointment, you will bring
Questions?
questions.
A notebook.
Um,
Oh, sorry.
Go ahead.
um, I had put in the chat, another thing you could say is I still have concerns and then put them on notice. I'm a big proponent for my geriatric clients to put doctors on notice. And I tell them to say, if you are not prepared to entertain my questions or ask any follow-ups, I think I need a second opinion.
Excellent. I love it. I
Yeah.
love it. I heard someone else. Okay. If I need some emotional support during this process, I would call a friend, a family member, maybe that person who has a little bit of knowledge and experience in medical settings, like Miranda said, and like, what can I say next time? Or can you come in, or can I call you when I get to the appointment? Those are all ways that people can participate without physically having to be there with you. Like, can I call you when the doctor comes in? Can I record this conversation? Ask the doctor, can you record the conversation? If they say no, I wonder why. But those are all things. And again, you have some options here. So your support during emotional support, maybe you're like, my doctor's treating me crazy. And I just want you to hear and be on the phone when they're talking back to me so we could double check that they're talking to me crazy, right? Okay. And then lastly, for this example, to document your symptoms effectively, you can maybe come on off mute and share with me what you might be able to do to document your symptoms effectively.
I keep track of all my test results, and
Mhm.
I also write down little questions. I have like a little journal with questions and concerns and things that I've noticed that are going on because they're not doing it. I've had some real nightmares recently, so situations. So that's what I do.
Good, perfect, writing it down. Yeah, because sometimes you need to be able to draw that through line to what's happening along with all these different things that are going on with your health. So thank you for that. So the next part is we're going to be right here. So who in your life would support you in this scenario? Like if you came to someone in your life, who would it be where you're like, man, I've been tired. My knees have been hurting, my hips been hurting, like my shoulders been hurting. Who would you tell that story to? Anyone, anyone? A friend?
A trusted friend,
Yeah, a trusted friend.
a
Maybe
sibling.
go ahead.
I said a sibling,
A
my
sibling.
sister.
Yep, someone else that's been experiencing joint pain or some chronic fatigue, and you use these people for different. Sometimes you need like again a sounding board. Sometimes you need someone who's more solution focused. And as you're talking to them, if you don't already know, you can start to determine who you might need in your corner. Like, oh, again, that sibling will pray for me and listen to me, but they can't do nothing else. That's not They just don't have the capacity for whatever reason. So I have
And
to
it is,
find
it
someone.
is a good idea to say it to somebody because so many people hold things in and
Yes,
then nobody becomes accountable. And you can kind of talk yourself into thinking, oh, nothing's really wrong, or this isn't really a problem, and other people have it worse, or that kind of thing. So it is good to say it because they can say, have you done anything? You mentioned this to me before. Have you done anything about it? So.
yeah, yeah, exactly. And again, that whole when you hold it in and you don't talk to people, your trusted people, like we start to feel like we're isolated and it's only happening to us, and we kind of get into that mode, right? And when you talk with someone, like you're saying, you get to share that information and you get to release it in some ways. You know, you don't hold it in inside and let it just fester inside of you. Cool, cool. So, oops, let me go back. Personal commitment. um who and what's the one resource that you would use if you were in this situation? Like, what do you think you see right here that you might have learned or relearned or remembered that you might like, hey, you know, if I'm in a situation where I'm feeling dismissed by my provider, what might I do? Is there anything, somebody named something that you might take away? Anyone? For me, I actually would use taking the time out. Sometimes I move too fast personally. When it's my situation, sometimes I feel like, oh, you know what, I didn't have to answer that question that quickly. I could have thought about my treatment or thought about my whatever, you know. So sometimes I don't take the time out to think it through and do nothing for a second. Anyone else?
Now, when you say resource, are you saying like the resource provided, like resources provided by the doctor's office or?
Just in advocacy, what would you use? What's one resource, one advocacy tool maybe that you learned right now, or you read like it just jogged your memory? Oh yeah, like you know, Donna said that she writes a lot of things down. Miranda says she, you know, puts people on notice. So, you know, what's one of the resource that you use or could use? So if you already have one, maybe that's not even listed here, that's useful, say it. If you're finding that you learned something particularly, like tell me
Well,
what.
if you could find somebody like Miranda, like to help maneuver the whole system with you and everything, and support you in advocating for yourself, that would be great. And it's great to know that there are people out there doing that.
Yes. Yeah, there are patient advocates and there are caseworkers and there are people in community that this is their job. And you have to kind of locate them. That's what I'm saying in your networks, like identifying who those folks are. And then for our last one is complete this sentence, and I'll give an example of my own. The biggest barrier to my own self-advocacy is dot dot dot. And one small step I could take is dot dot dot. So for me, the biggest barrier to my own self-advocacy is I forget to write stuff down sometimes. And I'll write it down and forget the paper or you know, whatever, right? And so it's like I have to remember that I need to take time out ahead of my appointments and list out everything that it is that I want to ask questions for, order it. And that's what I can do. That's the one small step that I could take is coming in a little bit more prepared to my doctor's appointments. Anyone else?
For me, a lot of times it's when I do advocate for myself, but I get dismissed, or they tell me, well, that's just the way it is.
Mhm.
I back down.
Yeah. So that goes back to like, please explain, you know, why this is, what is this the hospital policy? And there's another one that's not on this. It's called PTR, preference, tradition, or requirement. So they're saying they want to do something. Okay, is this a preference that you want to do this? Is a requirement like I have to do this? Or is this tradition? You've traditionally handled it this way all the time and you're not looking at any other method but this one, right? So that's also a way for you to like when they start pushing back, because they will, you know, that's not uncommon, that you can always go through that as well. And you can, again, sometimes in the moment, you can't really move forward, but you can think about what you wanted to say and express it and send a letter to your doctor via your their electronic record, or you can make another appointment with that doctor or another provider if you want a different provider or second opinion. So those are also options as well. So, well, thank you for sharing and participating with me. And so I'm going to close with this, that Dolores Huerta is the activist, Latina activist. She does the Si Se Pueda. And every moment is an organizing opportunity. Every person is a potential activist, and every minute is a chance to change the world. So every time you advocate for yourself or help someone advocate healthcare, you're making the system better off for everyone. Okay. And so I actually have a toolkit that I have given Brittany. So it's a PDF of the brain tools and the preparation before, during, after an appointment. There's a couple of things like that that she's going to share either by dropping in the chat or sharing with you all after this session. And I thank you for your participation. And if there are any questions, Q&A time. Let me look in the chat. Were there questions in the chat? Yes.
Oh, there was a question. Hold on, let me go back up. How can we decipher? Okay, I'm gonna ask this question is from Melinda Stevens, and then after we do this question, Carolyn Gage has her hand risen. So Melinda wants to know, how can we decipher the provider's opinion versus actual bias?
Yeah, I think, like I said, the PTR, the preference, tradition, and requirement, if you can remember that, that is not on my slide. So take a note if you have a notes down. That can be an option to really go through making the doctor or provider think about, like, is this a preference? Do you do this because this is the 53rd elevated blood pressure person you've seen this week? Or is this a tradition? You just typically have done this, you've done it, you don't think about it, that's just the way you do it. Or is this a requirement? Like, this is the best method for me. So going through that and asking them to explain themselves and re-explain it if you don't understand something is the best way. And then again, you might have to take a pause and come back to that conversation, if not in another appointment and some sort of follow-up email. You might have to, it may not be solved in like one session, one appointment. That, you're only in the doctor's office for so long before they're shuffling you to, out of there. So sometimes you have to like pace yourself and bring it up in that type of way. Otherwise, you might want to then look at escalating it. Is that helpful? Cool. So then I think Carolyn had a,
Yes.
okay.
First of all, I want to say thank you for taking out your time to come and present to us, and thank Brittany also. But in listening to it, I mean, and you may have gone over this because I was a little late, but when you get into the doctor's office, you have your questions in mind, and then they just totally go away after you're examined. So writing them down, that was very essential. And we have to hear that over and over again to write your questions down or your concerns. But I think my main question or comment is, like, with all the healthcare changes, we really have to be an advocate for ourselves, because we really don't know what's coming down the pike.
Right.
And the second opinions, if they are, or could they be, do you think, eliminated because of the healthcare changes that are coming? Do you think it would be as easy to get a second opinion, or we would have to go through, unnecessary changes?
I'm not versed on that in terms of future planning for our medical care. And it
Uh-huh.
all depends on whether or not, like, I would assume we're in California folks are either on Medi-Cal, like public insurance, Medicare, or they have private insurance. So if it's private insurance, you have to check with your private insurance carrier. They could select, I guess, whatever. But I think as a patient, right, you have an option to a second opinion. Now, if they take that away, I don't know what to do with if they take that away. But for now, be on top of what your symptoms, and if you want to speak to someone sooner than later, saying you want a second opinion, going in ahead of, before your appointment, if you have time, writing down your notes. For example, when I go into an appointment, especially if it's a new doctor, I come in like, oh, good morning, doctor, good morning, good morning. What are you here for? Oh, this is what I'm here for. I would like to talk about this particular thing, and then this particular thing, and then this particular thing. And then I start to go back. So the first thing I want to talk about is, like I said, this mole, this weird mole on my neck. I don't know if, can you take a look at it? I want to talk about it and see what's going on and see what they say about it. Then I want to talk about this persistent cough that I've had, for example. And I like run my doctor's appointments for the most part. Not saying that I'm perfect, but I come in because this is my appointment. I'm paying for it. You work for me at this point, and not like in that type of way, but not like in this power place, but it's like you're working for me right now, and I've had people tell me like their doctors have said, I'll only answer 2 questions. Like, what? Where? Is that a policy? Who's saying that, or I'll only answer, whatever, or they're really hard fast on that 15-minute, 20-minute appointment. And so you have to just be mindful of the system that you're in, and you have to come prepared. Like if you get a little blindsided and on that first appointment, and it's like, oh, okay, well, I'm gonna have to go retreat and reimagine what this looks like and get a game plan together. And you come back to the next appointment and you have your game plan together. So you don't always get to do it in the moment, and sometimes it's not a doctor's appointment. It's in an emergency room, it's when you're about to have surgery, and so the intensity and the emotions and the things change, but you still have options and you still have rights, and that's what you have to remember. But thank you for that comment. Is
Thank
there
you.
Thank you. Is there no problem with the toolkit. I hope you guys find it useful, and go ahead, share it with whoever you might need to, print it out, bring it with you, or pull it up on your phone before your appointments. Are there any other questions? I know we're at our time. One more question. All right.
Come off mute. Sorry about that. I was just downloading your toolkit, but in the chat, I'm not sure if anybody saw. I dropped what I do for my clients. There's this, you can't see it because of the AI thing, but it's 3 questions. Yeah, I just do it this way. It says, ask every time, what is my main problem? What do I need to do? And why is it important for me to do it? Because sometimes doctors just tell you. And I dropped the link that, it's quick, it's colorful, you can write it down, and then you have it with you. I keep it in my office for my clients, and then that helps them get agency, and then it conditions you. Those 3, if you have but one, that's great, but especially with medications.
Yes, certainly. Thank you so much for sharing that. I see it. It's, if you guys scroll up a little bit, there's a link she put at 12:32 p.m.
And in the event that it will not show for you, I'll drop my, with your permission, I'll drop my email because I can always send it out. I have it downloaded to my computer.
Certainly. So we have additional resources. So we can't have enough, too many resources. So thank you so much. And for me, with that, I'm going to hand it off to Brittany. I thank you for your time and your participation and your patience while I shared this, and I hope you found it useful. Thanks.
Yay! Thank you so much, Marna. That was very, very useful, very, very helpful. I will be emailing the toolkit out to everyone. And this presentation will live on our website, so it can be viewed as many times as you want. And if you all have clients that you think that this information can be useful for, please share this presentation with them as well. Thank you all for taking the time to join us during your lunch. Like I said, we'll be doing this once a month moving forward, highlighting different tools and techniques that we can use as we navigate medical care and as we navigate caregiving. So please be sure to tap in. We have another event coming up on October 24th. We are participating in Gumbo Week with Gumbo Social. We'll be hosting a happy hour for them. And even at the happy hour, we'll still be providing education and just, social activities. So I hope to see you all then. And thank you again for joining us. Thank you again to the wonderful Marna. Like, this was absolutely amazing. And you all enjoy the rest of your day and weekend. Thank you so much. Bye-bye.
Thank you. Goodbye.
Bye.